My name is Captain Felecia Hudson. I'm a critical care registered nurse. I grew up in Newcastle, Pennsylvania. My dad is a pastor, my mom's a minister. They have their own church. I have one older sister, one younger sister, and a brother. My job is about working with patients, making them better, and knowing that I've made a difference in their lives.
I'm David Overton. I'm a Medical Surgery Orthopedics Nurse. I'm a second lieutenant in the United States Army. People have different kinds of motivation for why they would want to join the Army. Some people are monetarily motivated. You know, they want to get their student loans paid for. Some people are patriotic. They want to serve their country. For me, it has just been something that I've always wanted to do. I feel like I'm contributing to something that's greater than me, contributing to a cause that's greater than me. To me, that's all the motivation that I need to stay in the Army.
My name is Captain Gwen Mueller. I worked as a civilian nurse in the Chicagoland area for about 10 years. I had sort of carved my path in life, and I was pretty content to be a civilian nurse. And then I decided that I wanted some new challenges, and so I moved forward and decided that the Army would be a great new challenge and it would allow me for more career opportunities. It's a very powerful job.
I wanted to earn my own living and pay for my own education.
I went to a lot of classes, a lot of leadership classes, a lot of military-based classes that allowed for me to expand my scope as an officer and as a professional.
The Army did pay for my nursing program. I did what's called the Green to Gold program. They paid for school, my salary that I got while I was in school.
I'm working on my master's degree and I'm taking 3 classes. The Army has a tuition assistance program. They actually pay 100%.
If you want to succeed in the critical care field, the Army will give you the opportunity to do that. If you want to be an OB nurse, the Army will give you the opportunity to succeed in that. If you want to become an advanced practice nurse, the Army will give you that opportunity. The Army will give you the experience that you need to succeed.
When I graduated from nursing school, I was commissioned as a second lieutenant in the Army and came back on active duty.
The pay on the military side I've found to be more than on the civilian side. And working for 10 years on the civilian side, you sort of have to job hop in order to make your money on the civilian sector.
Starting out, I'm at the same level as my peer group, but I'll pass them pretty quickly. And a captain's wages is around $70,000 a year.
And they also have raises based on when you advance in rank. And those are large chunks of money. I had not originally wanted to deploy. It was an interesting thing for me because I was walking away from life for a year.
Working on the battlefield and stuff like that, there is a sense of pride.
It's the mission that we have to accomplish. It's the job that we do.
When I was deployed, I really had the ability to influence people's lives, and I would have never understood it had I not been there. Anything that didn't involve the job was taken out, and on the purest sense, we got to practice.
Is it important to serve your country? Yes.
My quality of life as a nurse and an officer is actually quite good.
My health care is free. My family's health care is free. As far as my sons, their health care is free. You can't compete with that.
I have 2 cars. I have a 67 Camaro, which was my dream car I just bought about a year ago and been restoring it.
I have my own house. I have my own yard. I have every day-to-day activity that a normal person would have.
The misconception that people have is that your whole life is controlled by the Army. I still go home from work every day like everybody else, and the Army's not hounding me to come back in and do this and do that. So I think that's a huge misconception.
You have the opportunity to sit at a soldier's bedside and hear the story about what happened to him. It makes me very proud of what I do, and I love what I do.
I love my job. I strongly believe in holistic nursing. I not only need to care for the patient physically, but I think emotionally that I need to care for the patient as far as touching and talking to them like they're really a person and not just a patient.
They will impress upon you a sense of leadership, a sense of camaraderie, a sense of education that you would not get on the outside world. The Army is invested in me as a person. The Army is invested in me as a nurse. And to be a part of this team is something that I would never give that opportunity back.